I'm Dr. Ronald Gentile. I'm a retina surgeon from New York City. I'm in private practice. The practice is called Gentile Retina. I'm a clinical professor of ophthalmology, and I'm involved in patient care, research, and teaching. One of my passions in practice is patient satisfaction. I've noticed over the years in terms of training residents and fellows that they don't have any formal training when it comes to patient satisfaction. And patient satisfaction is to really have the patient have a good experience in the office and to meet their expectations and to meet their needs. I have looked through much of the literature in terms of training physicians in terms of patient satisfaction, and I have come across a method which I call the S.A.T.I.S.F.Y method, using the mnemonic S.A.T.I.S.F.Y. It's 7 steps that makes patient satisfaction relatively simple. The S in S.A.T.I.S.F.Y is the most powerful body language we have. And it's simple. It's the smile. Greeting a patient with a smile means you're welcoming them. Now this should be, your whole staff should be doing this, especially your front desk. You could imagine how many times I see patients come up to the front desk and the receptionist looks like this. A smile goes a long way. What about the A? The A in S.A.T.I.S.F.Y. That's a very basic need that all human beings have. They want to be acknowledged. Simple. You go to a hotel, you go to a restaurant, if you're sitting down or standing up waiting for someone to help you, you're not being acknowledged. How do you feel? When a patient comes to the office, they want to be acknowledged. It's better to acknowledge them by their name, and it gives you more of a connection. What about the T? T is a very valuable commodity. We all know this, and that's time. Time is a big deal. That's the hardest thing to actually accomplish. But guess what? You can. It can be done by scheduling properly and putting things in the office schedule and making sure that you prioritize and make sure the patient is number one. I, the I in S.A.T.I.S.F.Y. This is a little bit more complicated. It has to do with the patient's beliefs, it has to do with some of their rituals and their culture. And this is called intercultural intelligence. This is where you have to know the patient's culture and know their rituals. With some patients, you just can't shake their hand. Shaking a hand of a patient who is of a certain religion is considered impolite. There are other things like different sign language that some people use. The okay sign is not okay in certain cultures. And we have to sort of be aware of this. And this goes beyond cultures. This goes with generations, with sexual orientation, and you could just imagine all the different things you can come up with when it comes to what I call intercultural intelligence. Okay? What about the S? So now we're at S.A.T.I.S. And this is the emotional part of the experience. This is where we want to share with the patient's feelings. And this is where your IQ can be put a little bit to the side. We know you know all your techniques, we know you made the diagnosis, we know you have everything down pat. This is where your emotional intelligence comes into play, and you want to be able to connect and resonate with the patient emotionally. Now, you could have patient A and patient B, the exact same diagnosis, exact same prognosis. Guess what? Their reaction is going to be different. You have to resonate with that. Just because you're going to help the patient heal, there's another aspect to patient healing which has to do with the emotional aspect of healing. Now we're up to S.A.T.I.S.F. F is you want friendly hospitality. And we could take a lot of this from industry, from the hospitality sector. And if you ask most high-level clinicians in leadership positions, most of them would say we can take some advice from our hospitality colleagues. And what this means is treating the patient as if they're in your home and a visitor in your home. Now, what does this mean? Well, remember that smile we talked about and acknowledging the patient? Those come and those you want to do. But other things, like offering them maybe water or Wi-Fi in the waiting room, and treat them with what I call friendly hospitality. And then the why. That's the last of the S.A.T.I.S.F.Y. And that's the most important word. This is the word, a small word, that means a lot. This is the yes word. You want to be a patient's advocate, not a gatekeeper. So when approaching a patient, you want to be able to help them, not to put barriers between the patient and their care. And there's a lot of good examples of that. When the patient approaches the receptionist and asks, when is the doctor going to see me? Well, if you're a gatekeeper, you're going to say, please sit down, the doctor will be with you when he's ready. But if you're a patient advocate, you say, the doctor will see you soon, let me check and find out when he's going to see you and get back to you. The end result of the patient visit could be exactly the same. The patient could have walked in at 10 and left at 12. But their experience in the office can be very different based on the conversation they had with the receptionist. So I want you to remember that patient satisfaction is important for more than one reason. One thing is that it actually gives better care. Patients are more likely to be compliant if they're satisfied. That means your patient's going to come back in for their next injection, or they'll come in for their care, or they're more likely to listen to your advice. It's also going to make your staff a little bit happier. There's good correlation between patient satisfaction and employee retention and the happiness and how people feel in the office. It also correlates with profits. So tell all your administrators that this is important. So patient satisfaction and the patient experience using the S.A.T.I.S.F.Y program is a simple way to get you and your staff on board to improve the patient experience. It's really simple. It's really simple. It's not a hard thing. It's an easy thing to remember. Even if you just do the first three, smile, acknowledge, and time, you're already leaps and bounds ahead. If you can just do those three. They have to understand that the emotional aspect of patient care plays an important role. So that's where I am at this stage. I've done a couple of test runs in terms of training my staff and looking at my scores before and after implementing this training, and you can see the scores going sky high after the training. So what that means is taking those 7 steps, showing the staff how to do it, because the physician really needs to take a leadership role because they're the leader in the office, and get the whole staff to work as a team to get this done. And after the training, you can see that the scores have not only improved, but have reached levels that we even think were even possible in the past.